And here's the summary for endocarditis. Endocarditis is defined as an endovascular microbial infection which affects cardiovascular structures. Remember the principle of a superinfected thrombus, which is also called vegetation. It is a bacterial infection, very frequently Staph aureus, and it is a disease which has a very high mortality. The hallmark for the diagnosis is the vegetation, which can be seen with echo, but the diagnosis is not only made with echocardiography, but also with the help of blood culture and signs of infection. TE is superior to transthoracic echocardiography, especially in the setting of prosthetic valve disease, and it is very important to make the diagnosis as early as possible to reduce mortality. Complications of endocarditis include embolism, abscess formation, pseudoaneurysms, fistulous communications with other chambers, and valvular destruction, here for example a ruptured cusp. Right heart endocarditis, in other words tricuspid valve endocarditis, is very frequently associated with drug addicts. There we often see septic pulmonary embolism, and the most frequent pathogen again is Staph aureus. Prosthetic valve endocarditis is a life-threatening complication. It is a diagnostic challenge. Very often you will need TE to make the diagnosis. It can affect both biological and mechanical valves, and complications include abscess formation, pseudoaneurysms, obstruction, and valvular dehiscence. Pacemaker lead endocarditis is an increasing problem because more and more patients have pacemakers. We can distinguish early from late pacemaker endocarditis. Predisposing factors include pouch or pocket infection, sick patients, and systemic infection. TE is superior to transthoracic echocardiography, but some vegetations can also be detected from the transthoracic approach. The consequence is usually lead extraction, and we can also have other forms of polymer associated endocarditis, for example here on a catheter in the superior vena cava. Non-bacterial endocarditis is usually associated with systemic lupus, marasmus, and the antiphospholipid syndrome. It is a diagnostic challenge where we find valve thickening, only small vegetations usually, which are located on the ventricular side. The indication for surgery is always very individual, but basically we have to operate in the setting of heart failure, uncontrolled infection, the presence of complications of endocarditis, and if the risk of embolism is very high.